Another indispensable role of adipose tissue, often overlooked in discussions of metabolism, is its function as a physical protector and thermal regulator, both critical for survival in challenging environments. Subcutaneous white adipose tissue forms an insulating layer beneath the skin, dramatically reducing heat loss by limiting the conduction of body warmth to the external environment. This insulation becomes especially vital in cold conditions. Without adequate fat, the body would struggle to maintain its core temperature, leading to hypothermia and impaired organ function. Throughout human evolution, the capacity of subcutaneous fat to retain heat allowed our ancestors to inhabit colder regions, providing a selective advantage that highlights the essential nature of adipose tissue beyond mere energy storage. Adipose tissue also contributes to homeostasis by providing a soft, compliant cushion that shields vital organs from mechanical shocks and repetitive stresses. Fat deposits around the kidneys, known as perirenal fat, serve as a shock absorber that stabilizes these delicate organs against impacts or vibrations from movement. Orbital fat around the eyes helps keep the eyeballs properly positioned within the skull and protects the optic nerve from compression injuries. Fat surrounding the heart, pericardial fat, helps buffer the myocardium from physical trauma and friction against the chest wall during vigorous activity. Even within joints, small fat pads like the Hoffa's fat pad in the knee reduce friction and support smooth movement. Moreover, adipose tissue's mechanical properties extend to its role as a filler and stabilizer. It helps maintain the structural integrity of body contours, providing a supportive matrix that keeps the skin, muscles, and connective tissues properly aligned. This stabilizing effect not only contributes to physical resilience, but also to functional efficiency. By anchoring tissues in place, fat reduces the energy cost of movement and minimizes the risk of tissue tears or displacements. In clinical observations, individuals with severely depleted fat stores, whether due to advanced cachexia, lipodystrophy, or extreme caloric restriction, suffer not only from impaired metabolic functions, but also from increased vulnerability to mechanical injuries and impaired thermal regulation. They are more susceptible to pressure ulcers, bruising, and hypothermia, underscoring the fundamental protective functions of adipose tissue in maintaining bodily integrity and temperature stability. Taken together, these physical roles of adipose tissue illustrate that fat is not simply an energy bank or endocrine organ, but also a structural safeguard essential for mechanical protection and thermoregulation. By cushioning organs and conserving body heat, adipocytes support the stable internal environment necessary for all physiological processes to function optimally. This evidence once again reinforces the view that healthy adipose tissue is a critical ally in preserving systemic homeostasis, not an inherent liability, and that fat cells, when functioning properly, perform irreplaceable tasks that sustain human health and resilience.